My dear students, from the previous classes, we already discussed about central nervous system stimulants. So, central nervous system stimulants mainly divided into two major classes. They are naturally occurring drugs and xanthine derivatives. Then second one is synthetic agents. In this video, we discuss about naturally occurring drugs. So first of all, caffeine. So caffeine is present in tea and coffee. So this is the structure of caffeine. So the chemical name of caffeine is 1,3-trimethyl xanthine. So this is xanthine structure. Then here it is the 1, 3 and 7 having the methyl groups. So for 1,3,7 trimethyl xanthine, it is a structural formula of the caffeine. So properties of caffeine: it occurs as a white colorless powder and has a bitter taste. It is sparingly soluble in water and is more soluble in boiling water, alcohol and chloroform. And it is a very weak base and readily forms a salt. So the caffeine has some important physical properties. So it just looks like a white in color, then colorless powder form, and has a bitter in taste. Okay, that is the taste of the caffeine. It is sparingly soluble in water, means partially soluble in water, and is more soluble in boiling water as well as alcohol and chloroform. So it is a very weak base and readily forms a salt when it is reaction with any other form of the chemicals. It gives a salt. The salt with citric acid, the caffeine citrate, that is a citric acid salt, it is mainly used in formulation with other drugs. So it is a caffeine is used as a some formulations with other drugs. So make a supportive chemical for the formation of the drugs, and it forms a water soluble complex with sodium benzoate. So this all are the important physical properties of caffeine. Next we have the actions and uses of caffeine. Then the more important principal therapeutic actions of caffeines are: it produces wakefulness, so it gives a refreshness when we are using the caffeine in any food material. So it enhance mental activity, means enhance or refresh or make activeness in the mentally, and stimulates respiratory centers, means it helps to increasing the or makes the more active work of the respiratory centers. So these are some important usefulness or actions of the caffeine. And it is employed in the headaches of certain types like neurologia, then rheumatism or rheumatism and migraine, etc., usually in 200 milligram dose. So that much small dosage of the caffeine can relieve the headache of the certain types, that is neurologia, then rheumatism, then migraine. So such type of the headache problems can be solved either singly or in combination with other analgesics. So analgesics means that is pain relieving property of medicines. So in large dosage it produces insomnia, restlessness and delirium. So that type of the some forms the side effect of this dosage also if it is increasing the more than 200 milligram of dose. Okay, so next preparation. So caffeine citrate or citrated caffeine tablets or caffeine, then sodium benzoate and its injections are some commonly used preparations. So these are some important products can be used to preparation of the caffeine, mainly from the caffeine citrate, citrated caffeine tablets also, then caffeine and sodium benzoate. So some of the products may be from the caffeine preparation. Then theophylline and theobromine are the xanthine derivatives. So here we have some theophylline and theobromine. These are the two derivatives of the caffeine. So these two derivatives, theophylline is present in tea, while theobromine in coca. So both these drugs have similar physiological actions like caffeine. So both structurally have different but more active, more usefulness as that of caffeine. Then theophylline is mainly used as xanthine bronchodilator and its salt with ethylene diamine is known as a aminophylline. So some of the products of this theophylline and theobromine, it is widely used in asthmatic conditions. So they are also one of the important medicine in the asthmatic conditions. So these are the two derivatives of the caffeine. One is theophylline, then theobromine. The crude drug lobelia and the other alkaloid lobelia show mild CNS stimulants. So it maybe helps to stimulant of central nervous system activity. The lobelia hydrochloride was mainly used for its respiratory stimulant. So this is the one of the lobelia hydrochloride is a derivative of caffeine and it is mainly used for its respiratory stimulant activity. So this drug is no longer official and not in use also. So we cannot use more properties of that lobelia hydrochloride. Then picarotoxin and citrikine hydrochloride also have a powerful central nervous system stimulant and convalescent activities for the central nervous system. These drugs have been replaced by more active and potent synthetic drugs. So these are all having the some naturally or occurring drugs. So these not used more and more for the medicinal field. Then these drugs have been replaced by the more active and potent synthetic drugs. So next class we have discussing the about the synthetic agents or synthetic drugs. My dear students, in this video you have to study about synthetic agents. Compounds form various chemical classes, show the central nervous system stimulant activity of varying degree The useful drugs in this category are made from the synthetic preparation of stimulants. So first of all, we have the leptazole. It is also known as pentaterazole. So his property is it occurs as a crystalline solid substance with a bitter taste, and it is soluble in water, the also in the form of aqueous solutions, are stable and can be sterilized by the autoclaving. So this is the important synthetic agent which can be depressant substance for the central nervous system. So mainly it is a crystalline solid also, and the taste is bitter taste which is soluble in water mainly, and it has aqueous solutions, stable, and it can be sterilized by the autoclaving sterilization effect. So dear students, so this is about the structure of leptazole. So here the 6,7,8,9 tetrahydro 5H tetrazoloprazine or 1,5-pentamethylene tetrazole is the chemical name for the substance leptazole. So it is about the very complicated structure of the leptazole. So if you study about the actions and uses of this drug, so it is used in the form of an injection in 200 to 500 milligram, or it may be 50 to 100 milligram as per IP, Indian Pharmaceutical. In the treatment of respiratory depressions, so this dosage can be, or this medicine can be used to respiratory depression, and also in case of the schizophrenia in a small dosage. So such type of the infections can be treated by this drugs. So here the very simple preparation is leptazole injection is officially in the IP, Indian Pharmaceutical. So this is about the first synthetic drug. Then second one is nicotinamide is one of the important synthetic drug. So it is a very simple structure with NN diethylenic thiamide. So what are the properties of this nicotinamide is, so it is a pale yellow liquid with a characteristic odor and bitter in taste. So which are the different odors, so that is characteristics, and it is a bitter taste, and it is soluble in water and alcohol. Also the aqueous solutions are sterilized by the filtration or by the autoclaving method. So it is very simple technique for the soluble in water as well as alcohol, and it is sterilized. Filtration can be used, or by the autoclaving method can be applicable for the drugs. So it is given either by a intramuscular form or subcutaneous or intravenous injections in 25% volume solutions. So in 1 to 4 ml dosage as per respiratory stimulant in a respiratory depression procedure by the morphine or volatile anesthetics. So such type of the medicine is used in the patients. So that is a nicotinamide. Then we have the next synthetic drug is bimagride. So this is the structure of the bimagride. Beta ethyl beta methyl glutaramide is a structure chemical name. So it is a white crystalline solid with a bitter taste and is sparingly soluble in water. The solutions are stable and are sterilized by the autoclaving in conditions only. So it is a one of the medicine for respiratory stimulant and is employed in the barbiturate poisoning in 50 gram of dosage at intervals of 10 minutes up to the total dosage not exceed 1 gram. So very small dosage can be used for the less than 1 gram of the drugs or medicine can be used for the respiratory stimulant. So it's a very important medicine for the respiratory stimulant. So next synthetic drug is amphetamine sulfate. So this is the structure of amphetamine sulfate. So alpha methyl phenethamine sulfate. So here the whatever the properties of amphetamine sulfate is a salt of an amphetamine is a base formation mainly. It is occurs as a white powder with a slightly bitter taste. So the appearance of the substance is white powdered and bitter in taste. It is soluble in water. So it is a condition is soluble in water. Then if you have the actions and uses, it is given in 5 to 10 milligram dosage either orally or by pentaternal route in the treatment of mental depression patient in narcolepsy and as an adjacent in the treatment of alcoholism. So those have people's addicted for alcohol, such type of the patients can using the dosage of amphetamine sulfate. So few mentally depression patients also having the such type of the medicine can be used. So that is the action and uses of the this medicine. So next one we have the methamphetamine hydrochloride. Methamphetamine hydrochloride. So here the chemical name is 1-methyl 2-phenyl ethyl methyl ammonium chloride. So his property is very simple. It is a hydrochloride. It is a hydrochloride salt of a methamine or methamphetamine base. It is a white crystalline solid. Yes, it is a white crystalline solid with a slightly bitter taste. The drug is soluble in water and alcohol and chloroform. So it is all that synthetic drugs having their soluble in water and some of few of them are alcohol and chloroform. Okay, so if you have to study the actions and uses of this, it is administered orally in the form of tablets for its euphoric and antidepressant activities. So in 5 milligram dosage, very small dosage, 5 milligram, the drug has to tendency to produce habituation and tolerance. So if you have any habitual and tolerance can be addicted, patients can be use such type of the medicine. Its appetite depressant property is used in the treatment of obesity. So the obesity can be treatment can be using these medicines very easily. Then finally we have a number of drugs related to the amphetamine and called as sympathomimetics also possess anorexic nasal decognizant and fuel central nervous system stimulant activities also can be act as a synthetic drugs here. These drugs are possesses more process and adrenergic activities. So for they are discussed in the new chapter, that is the one more new chapter you have the syllabus, but here only we have discussing the few medicines like drugs which are natural occurring as well as synthetically prepared drugs in the central nervous system depressant. Okay, so you have any queries, can further contact to the lectures. Thank you.